Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain Free with Dr. Marc Darrow from the Darrow Stem Cell Institute in West Los Angeles. This is the program that can give you effective solutions for the pain you've been living with. Dr. Darrow is a medical doctor, board certified in physical medicine and rehabilitation. He teaches about the use of prolotherapy, PRP, and stem cells. Today's program could open up a new life without pain for you. Now, here's Dr. Darrow with his co-host, Dr. Nita Valens.
Hi there, Dr. Darrow.
Hello, Nita Valens. How are you today?
I'm great. How about you?
I'm living it up. Can you tell?
I can. I think that's very exciting. And I also think that we need to have our listeners live it up just like we do. So if you're having orthopedic pain, musculoskeletal pain, and that means joint pain, tendon pain, ligament pain, disc pain, back pain, neck pain, knee pain, hip pain, arthritis pain. If you have stiff joints, dull legs, maybe you can't figure out the origin of it. Basically, orthopedic or musculoskeletal pain, that's what this program is all about. You can call and talk to Dr. Darrow about it right now at 866-870-5752 right here in the studio. Speak directly with Dr. Darrow. That's 866-870-5752. And we have a goodie for you when you call the program today. You get Dr. Darrow's latest book for free. It's called Stem Cell and Platelet Therapy, Regenerate, Don't Operate. It has 264 scientific studies, and the foreword is written by Suzanne Summers. And also, I'd love for you to go to the website, www.lastemcells.com, and see Dr. Darrow performing the treatments on videos. And you can also email him off of every page on the site. That's www.lastemcells.com. And we're here Saturdays at 10, again at 1 p.m., and we'd love to hear from you. The hour goes so fast, Dr. Darrow, that we end up with so many people at the end we run out of time. So call right now, early in the hour, 866-870-5752.
Excellent.
Okay.
So, Nita, why did the traffic light turn red? You would too if you had to change in the middle of the street.
Oh, gee whiz.
Did you hear about the fire Did you hear about the fire at the circus?
No.
It was intense.
Oh my goodness. I don't know where you're getting these, but they're hilarious.
I get them from my patients, and I had
very corny.
Well, we can't do anything else on the radio but that these days.
Of course.
One last one from this wonderful patient yesterday that came in.
Okay.
When does a joke turn into a dad joke? When it becomes apparent.
Oh, that's a good one.
So I'm going to talk about my patient who came in yesterday. I'm not going to mention any names.
Okay.
This is a very wonderful young lady who came in after 2 neck surgeries. Not one, but 2. The first one was a fusion and a discectomy. That means the cushion between the vertebrae and the neck was removed, and then it didn't work out well. As you know, I just saw a study yesterday where someone did a sort of a Panavision of all surgical types. You know, when the studies are done to see who does well, who doesn't do well. And unfortunately, there weren't very many that did well overall. Sometimes people do get better for a while. Sometimes they don't at all. But in the long run, things are not great. And it's unfortunate that the orthopedic surgeons, who I do love dearly, they do very tough work. It's unfortunate they're doing all these surgeries that really don't need to be done. This neck surgery, these 2 neck surgeries, and by the way, this young lady was told she should get a 3rd neck surgery. We already know the studies show that the more surgeries you do in one area, the worse the area gets. So I don't get it. I don't know why these guys keep doing it. Nevertheless, the study that I saw showed that you don't want to be doing these surgeries. Meniscal tears, rotator cuff tears, labral tears, all of these things. Why don't the surgeons read their own studies? I do not know. You folks who know me, who have been listening for years to this show, and those of you who are my patients know that I had a surgery on my shoulder, my right shoulder, when I was doing orthopedic surgery in medical school by my boss, who I adored. He was a great professor, a great teacher, and it came out bad. And my arm swelled up, full of fluid, and I had a high fever, and I was terrified. And it never really quieted down completely. I still had a lot of pain after that surgery for a few years until I learned about regenerative medicine. I'm holding up a book. You guys listening on the radio can't see it, but those of you watching this video can see it. And it's called Stem Cell and Platelet Therapy, Regenerate, Don't Operate. And in this I have about 250 studies in the back. They're all listed, but they're interspersed in what I've written about how surgery is not really the best answer. And in many cases it has to be done. There's no question about it. I'm not saying that. You know, if you have a broken bone and the bone's sticking out of your leg, you better get surgery right away. But I have people come in every single day, new patients, who have had a surgery that didn't work well. Obviously, they're coming to me because it didn't work well. If it worked well, they wouldn't need to come to see me. Or people who come in and say things like, I have bone on bone in my knee or my shoulder, and I've had 3 orthopedic surgeons tell me I have to get a surgery. And I examine the body part and forget about the MRIs and the X-rays because they're big liars. They show things that don't necessarily cause pain. It doesn't mean I don't want to see them. I do want to see them so I don't miss anything. But the point is, most of these people never had to get a surgery. They get better, okay? With me or without me maybe, but with me for the last 20 plus years of doing regenerative medicine. And what is regenerative medicine? It's using platelets from your blood or bone marrow from your bones. The bone marrow has platelets and stem cells, and we can just inject that. You just walk in the door and get injected and walk out. So there's very little chance of infection. There's very little chance of things getting worse. And for those of you that want to see my Yelp reviews, YELP.com, go there and look up Marc Darrow, MarcDarrow, MD, and see what people have to say about these procedures. I think there's over 150 reviews there. They're not all perfect. There are some people that I think may be a little cranky from time to time. And the crazy thing is I'm not allowed, no matter what someone says in a review, I'm not allowed to respond to that patient because of HIPAA. It's a privacy law, which is really strange. They can attack me, but I can't tell the truth. But when someone does attack, I do write back, and you can look at these. I write back. I can't write back about that patient, but I can write back about generalities of surgery or regenerative medicine. So in my mind, the best thing to do is always to do the simplest, most conservative thing in medicine. And surgery is not high on that list. It's very invasive. So take it from me, one who's had a failed surgery on my shoulder, which, by the way, was healed with one series of injections by myself into my shoulder, waking up the next morning completely pain-free with full range of motion. And then I did other parts of my body. I've been injecting myself for over 20 years. And you might say, well, why do you have to keep injecting yourself? It's because I'm a crazy athlete. I do everything to excess in sports and music. I like repetitive things. So when things start to hurt, I don't listen. Do you? No. I keep going until it doesn't work anymore, and then I inject myself. Luckily, I haven't had to inject myself in a long time. I've been a good boy. How about you? So I'm going to give out our phone number, and because I'd love to talk to you personally right now And like Nita said before, if you wait to the end of the hour, we're not going to be able to get to you because that's when everybody calls in. Everybody seems kind of shy, and they wait till the end when someone else calls in first. But if you call now, you'll get to talk to me. The phone number to the studio right now, you can talk to us live, is 866-870-5752. And I'm going to repeat it for you in case you're driving or you're running to get your pencil. The phone number right now to reach me is 866-870-5752. If you call in, I'm going to give you a free copy of this book, which we charge $25 for, so you get it for free. It's called Stem Cell and Platelet Therapy, and the byline is Regenerate, Don't Operate. And there is a wonderful introduction by Suzanne Summers. I love you, Suzanne Summers. Everybody loves you, of course. You're amazing. And Suzanne is a great proponent of medicine that works. What does that mean? I'm not going to call it alternative medicine because it's not alternative. It was here before traditional medicine, which is drugs and surgery and chemo and all those kind of things. It's stuff that works. It's natural. And thank you, Suzanne Summers, for being really the biggest proponent on the planet for doing these types of medicine that help people instead of hurt people. I'm not for drugs. I'm not for surgery. If you want those, don't come to see me. I'm not that guy. I can give you referrals to other people that like to do that, and I'm happy to do that if you want. But I prefer that you try, if you have musculoskeletal issues, meaning you have arthritis or neck pain or back pain or joint pain, whatever that is, come see me. I'm happy to see you. If you want to get to the office to get even more information, where there's people by the phones all the time, and the phone number to my office is 800-300-9300, 800-300-9300. So, one more joke, Nita?
Let's do it.
Okay. How come pirates never bathe before they walk the plank?
Because they're going to fall right into the ocean.
Well, that's kind of close. That's the closest you've gotten so far.
I know, right?
Because they're going to wash up when they get to the shore.
Oh, gosh. You're right.
All right, just one more for you, because I got to hear that laugh. Which fast foods place is the favorite of pirates? Arby's.
Oh, God. I never would have known that one. Never, ever.
I'm hungry. I want to go to Arby's. Arby's, maybe you could be a sponsor of the show.
It's funny you say that because I got an idea. There's a place that advertises right before our show every week. It's Columbo's Steakhouse in Eagle Rock, and it's Italian. It's an Italian restaurant, but they specialize in steak. And I listen to this like 5 minutes to 10 every Saturday, and my mouth is watering for a steak. And Alex said to me, "Why we should get them to sponsor the show."
I think that's a great idea.
So I think we should go. So you and I should go over there, have a steak like on a Saturday after the show, and after you golf, like later in the afternoon. And we need to talk. I got the name of the owner and everything. I'm on this.
All right, go do it.
So,
all right, so
anyway.
I'm gonna go to somebody that's got 19 shoulder dislocations. How about that?
Okay, well, first let me give the phone number. If you're ready to call, don't wait too long, 866-870-5752, right here in the studio, and you can speak with Dr. Darrow right now. Go ahead.
Here we go. So, a gentleman emailed me, and by the way, on every spot on my website, which is www.lastemcells.com, that's www.lastemcells.com, there is a spot to email me. So I answer emails all day, all night long. It's the first thing I do when I wake up. It's the last thing I do before I go to sleep. And I do it in between patients. I love talking to people. So this person said, "So I have an issue with my shoulder. I've had 19 dislocations." Dislocation is where the joint separates. The humerus bone comes out of the glenoid joint. And I wanted to know how this procedure could help me out. And can you help me? So the answer is probably I've had many, many, many patients that have dislocated shoulders that go in and out from time to time. Many of them have actually had a capsular reduction surgery where they tighten up the capsule of the shoulder so that you have less range of motion, and it's supposed to not dislocate anymore, but some of these don't work, and the patients come into me after their failed surgery and they're still dislocating. What I do is I take platelets and or stem cells or both from your body, and I inject them all along the rotator cuff tendons. There's 4 of them. Okay? The supraspinatus is the one that is most frequently injured and most likely has tears in it. But you don't have to have tears in your shoulder rotator cuff to have dislocations. They can just get stretched out. So I do a procedure where there's a lot of pokes on all of the areas, and into the joint itself also. I use an ultrasound to look inside. Do not ever have any doctor inject you in your shoulder, your hip, your knees without an ultrasound to see where that needle is going. They're guessing. And that's the way we were all trained in medical school, to guess. Well, since then, studies have shown that when we guess without an ultrasound, the solution does not go into the joint at least 1/3 of the time. I get
Ouch.
people who come in all the time and they've had PRP or stem cells and say it didn't work. And I say to the doctor, use an ultrasound. No, they didn't. How many pokes did you get? I got 1 poke. You can't heal a shoulder with 1 poke. It just can't be done. There are too many potential pain generators. And looking at an MRI doesn't tell you where that pain generator is. You can have a supraspinatus tear in your shoulder, but that doesn't mean that that tear is where the pain is being generated from. It could be coming from the joint. It could be coming from the subdeltoid bursa. It could be coming from the subscapularis tendon, the infraspinatus tendon. There's just a lot of stuff going on that you can't see with an MRI. And even if you see it, it won't show you where the pain is coming from. To wit, as I say as a lawyer, that means, for example, my shoulder has a subscapularis tear and a supraspinatus tear and a labral tear. The labrum is lip in Latin, and it means the fibrocartilage that's around the humerus that helps hold the humerus in place in the glenoid joint. So I have those 3 tears. Do I have pain in my shoulder? Nope. I'm lifting it up right now, swinging it around in front of the camera. You guys on the radio can't see this. I'm ready to go to the rodeo and what do they call it with the rope?
Lasso?
I'm ready to lasso. I'm ready to play golf. I'm ready to do whatever I want to do with that shoulder. It just doesn't bother me. I did inject it a few times. I still have those tears. I didn't fix the tears. That's a mind bender for people. Tears don't cause pain necessarily. Could they? They could. But they usually don't. It could indeed. They usually don't. You want to take that caller? I can hear you breathing.
Yeah, I breathe. I do breathe. I forgot to stop breathing.
Brian, hi, Dr. Marc Darrow. You live in Torrance and you got a knee issue. How long has that knee bothered you for?
I don't know, 10 years.
Whoa.
Ouch.
Did you go to a doctor to find out what he thinks going on?
No, I got both stem cells and all that, and it didn't work.
Okay.
What are you going to do differently? Because I don't want to get a knee replacement.
Okay. Can you walk around?
And hello?
Brian, can you walk? Can you bend your knee?
Yeah.
Okay.
Yeah.
Then you don't need a knee replacement right there. Okay, that's my opinion. Don't crucify me for my opinion because it's different than a lot of other people, doctors. But I don't like these knee replacements. I see them fail all the time. There was one patient who came in for a right knee, and I examined the left knee and it didn't move. And I said, what's up with that left knee and that giant scar all the way through it? And they said, oh, I had that replaced. And I said, well, what happened? It's not moving. The guy limped in the office. And he said, it didn't work. So I don't like those surgeries. And I'd have to examine it to see what's going on. I'd look inside with an ultrasound, but I wouldn't do a knee replacement if I were you. Not if you're able to
My
move it and you
question
can
is,
walk around.
on an average, what do you charge on the average patient? What are you charging?
There's no such answer to that. I'm going to get your pencil and write this down. The office number is 800-300.
Oh, I called your office before I called, and then
Okay.
they weren't in right now.
They're in. They're just busy. They'll get to you.
Okay,
That's not something. It's not something I can discuss on the radio. It's confusing and complicated. What I would tell you to do.
I had PRP done, and I haven't had stem cells done, but
Okay.
PRP I did it 3 times, didn't work.
Okay.
I mean, it felt good for like a month, and then started going back to the pain.
Okay.
I
I'd have to
have
examine it, Brian.
osteoarthritis.
Yeah, I'd have to examine it and take a look with the ultrasound and see what's going on. You know, to be honest with you, I can't tell you a darn thing unless you come in the office. I'm not trying to hustle you in. I'm just telling you that's the truth. I don't look at your MRI
Okay,
to
can I ask
decide
you
what's
one
going
last
on with
question?
you. Sure.
You said sometimes it doesn't work, so what are the alternatives then?
Well, I didn't say it doesn't work. I said there are
No, you
times
just said
when
sometimes your patients don't it don't work for them. They don't come back. So what are their
yeah,
alternatives?
sometimes you're right. That's the answer. Sometimes they don't come back.
Yeah. So
I don't know how
if
many.
they kept on coming back, it probably would have worked.
No, I didn't say any of that. So
Okay.
if you want to listen for a minute, I'll tell you what I am going to say.
Okay.
May I speak?
Go ahead.
Okay. So all we're doing when we use regenerative medicine using your platelets or your bone marrow, which has stem cells and platelets, is we're generating tissue to grow. We're stimulating tissue to grow. And then how soon will you feel better is not something I have the answer to. I have many, many, many people who I can't find a darn thing wrong with, but they have a lot of pain. We do an MRI, we look with the ultrasound. We can't find anything. We do an x-ray, we can't find anything. And they have terrible pain, okay? Those people sometimes heal up real quick and sometimes don't heal up real quick. There's a few major reasons why people don't heal. Okay, you ready? You want to write these down? Mm-hmm. One is they stay active. They don't let it heal. Okay, that's number one reason. I get so many people who are sports addicts who have 30 stairs to climb to get up to their apartment, and they have a knee problem, and they go, why aren't I getting better? Okay, or they're continuing to play golf or go running or swimming or whatever their sport is, and they're not going to rest. So they stay active. That's number one reason for failure. Now, is tissue growing? Yes, it is. Now, when these people get sick and tired of being sick and tired, okay, and they have the pain and they've had a few injections, and I say, look, you shouldn't get any more injections because you're not going to let it heal. And they go, okay, doc, I'll stop. Typically, within a week, I get a phone call going, oh my God, I'm all better. Okay, so staying active is going to inhibit a person from feeling better. Okay, number 2, people take non-steroidal anti-inflammatories like ibuprofen. Mm-hmm. You know what that is, right? Mm-hmm. Yes? Okay. So what does ibuprofen do? It blocks inflammation. Inflammation is needed to heal the body. When we get an inflammatory cycle, which nature does by itself, so if you sprain an ankle, it gets swollen. Okay? That's a good thing, because when there's swelling like that, the body sequesters or draws to the area cells called fibroblasts, and fibroblasts grow tissue. Okay, do you understand that? So
yeah.
don't be taking anti-inflammatories when you get an injury. All right? Now, number 3, so number 1 is people stay too active. Number 2, they take anti-inflammatories. Number 3 is they don't get enough treatments. How many is that? Everybody wants to know when they walk in the door. Hey, stick with us, Brian. We'll pick up the break here and get right back to you with the rest of this. Good questions. Thank you.
You're listening to Living Pain-Free with Dr. Marc Darrow. Grab a pen or a pencil. Write down this information coming your way. I'm your host, Nita Valens, and we'll be right back.
You're listening to Living Pain-Free with Dr. Marc Darrow. Dr. Darrow's practice is located at the Darrow Stem Cell Institute in West Los Angeles. To schedule an appointment, call 1-800-300-9300. That's 1-800-300-9300.